Hi, I'm Brenda Sandmaier. I'm a physician scientist located at Fred Hutchinson Cancer Research Center and University of Washington in Seattle. Today I'm talking about the question about how safe and efficacious is conditioning with radiolabeled anti-CD45 antibody on astatine 211. I recently presented preliminary data at the TCT meeting last week. Now, this is an interesting question to discuss because right now we're in a phase 1 dose escalation portion of the trial. We did the initial first-in-human studies and have done dose escalation and until we had a dose-limiting toxicity. And at that point, we were doing single patient dose escalations, and depending upon how long it had been, sometimes treating patients, more than one patient at the same dose level. But when we hit a dose limiting toxicity, we dropped down one dose, and now we're currently including patients at one of the doses to see if this is the effective dose. Now, with the preliminary information that we do have, this seems to be quite safe. The actual treatment with the drug is well tolerated. Patients are treated in the hospital because this is first in human studies, but they're able to be discharged by the following morning, as their infusions usually don't complete until later in the evening. And they're able to be back in the outpatient to complete the rest of their conditioning for transplant. In essentially all patients, except for the patient at the lowest dose, we saw clearance of peripheral blood blasts, and the majority of the patients on the first bone marrow evaluation at about 1 month after transplant showed clearance of their disease. Obviously, as this is a phase 1 trial, the most important outcome is safety. And we will not be able to really make a definitive statement until we're more into the phase 2 portion of the study. But currently, we're very excited about the results, as this really was a translation of work that we had done in our preclinical studies and were able to successfully translate into patients. Thank you.